This video will teach you about the Ad Hoc Adult Basic Admission Form. Ad hoc is where the other forms are kept. Think of it as a file cabinet for forms that are not usually in every chart. If you need any forms, this is where you find them. It is located in your toolbar at the top of the page. By clicking on Ad Hoc, a list opens. On the left are file folders, and on the right are the contents of that folder. In our example, we will be using the Basic Admission Adult form. Note, the Basic Admission form should be in your task list to perform. This is where you should open this form and document so it'll come off your task list. If it is not there, then start with this file. Choose the Basic Admission Information Adult by clicking in the checkbox and then choosing Chart to open the form. In our example, the vitals are a temperature of 99 degrees, a pulse of 88, a blood pressure of 147/95, and an O2 sat of 90% on 2 liters by mask. Note the temp is in Celsius, not in Fahrenheit. There is a conversion calculator at the top of the form. By clicking on it, a clinical calculator opens. Use the drop-down option to open choices for conversion. Choose Fahrenheit to Celsius. Enter in the information and the conversion will appear below. Close by choosing the X. Enter 37.2 in the temperature box. Note the box next to that entry and how both conversion amounts are there. Enter in the rest of the data. Use the tabs to navigate to the next section. Weights also need to be converted to metric. Use the calculator to perform this task. You must enter in the dosing weight and the weight measured or estimated. The dosing weight is for the pharmacy and the other is for staff. The pharmacy needs this weight in order to determine dosing. This section is for charting education and safety needs. Enter in information by checking the appropriate boxes. Note the blue text. This is to guide you in charting the standard of care met for these areas. There are conditional fields that are grayed or dithered out that will open when more information is needed. For example, when demonstrates ability to use call light successfully is checked, no other window opens asking for more information. Fill out appropriately for the individual patient. This section is to chart what items the patient came in with so we can be sure to get them home with the same items. Be as generic on this information as you can. Do not attach value to these items because you don't really know this information. If the patient is wearing a wedding band, type the description as follows: yellow band with a clear stone. Be sure to chart this information and send items to security to lock up. Chart that you sent these items with security to the safe along with the envelope number. If a family member took the items home, be sure to chart that information and the name of who you sent it with. Be sure to chart hearing aids, dentures, glasses, and artificial limbs. These items are expensive to replace if lost. When complete, sign the form by choosing the green check mark. You can save this form and return at any time by choosing the floppy disk at the top of the form. It will not come off your task list until the form is signed. Once signed, this form can be found by clicking on the Form Browser tab. Look for the name of the form. You can modify this form by right-clicking on it and selecting Modify, which will open up the form. Enter in the needed information and sign by choosing the green check mark. This completes the video on how to document the Adult Basic Admission Information Form.